I'm Jackie Gardner-Nix, and I'm going to be doing a series of recordings with my colleague Christie Tait, who's a nurse practitioner. And what we want to do is share our experiences of living with migraine headaches for our entire lives, but also treating them. So the series will be a sort of a number of short recordings that we'd like to share with you, where we talk about how it impacted us, but also what we have picked up along the way, knowing about migraines and how to treat migraines. And Christy, do you want to do an introduction of what a nurse practitioner is? Many people
Sure.
won't know. We're in Canada, by
It
the way.
is true. It's true. Thanks, Jackie. So I'm a nurse practitioner in Ontario, in Canada. And what a nurse practitioner is, well, we start off our careers as registered nurses, which requires a university undergraduate degree in nursing. And then you have a minimal amount of time that you have to practice clinically. So at least 2 years. For myself, it was several more years than that in the emergency department. And then I went on to do an advanced degree, so a master's degree and an advanced clinical degree to become a nurse practitioner. So after doing all of that with several more advanced clinical placements, I have an expanded scope of practice. So it means that I can do assessments, make diagnoses, order any investigations that might be helpful or relevant to making those diagnoses. I can prescribe medications. And so really kind of manage the whole spectrum of care of patients.
It's really tantamount to being a family physician. And you have chosen to specialize in migraine and post-traumatic headache, very near and dear to your situation. And I find with nurse practitioners who are tremendously helpful in trying to expand the availability of primary care in Canada that you guys probably work more holistically than we as physicians can within the framework we've been given. So now I was only a family physician for a few years and then stepped into focused practice in chronic pain, where I certainly treated a lot of people with migraines. But what I valued in being able to do a focused practice was that I could work more like you guys in that I could be more holistic and I could spend the time to do what I preferred, which was narrative medicine, a type of medicine where you learn about your patient, their entire lives. I took them through their entire life accounts where they would provide me with the information that I felt was so relevant to treating and managing their migraines. So I was working out of a pain clinic in that way. And Christy, you were working out of, just say where you worked out of.
Yeah, so I also kind of had a trajectory. So I worked for many, many years in the emergency department, and as we know, that's a common place for migraine sufferers to end up. I did train in primary care, but I very quickly moved into a specialty of neurology with a focus on headache and migraine. So that's exclusively really what I do now. And I love what you talk about, Jackie, with that kind of narrative. I always say that I'm sort of painting a picture of, somebody's lifetime and lived experience with migraine. So whether they're in their 20s or 40s or 50s, like I want to kind of see that journey, and I think both of us know that there's a lot of value in seeing that every individual with migraine is going to have a different story and experience, right? And you have to, as a healthcare provider, understand that to be able to offer meaningful, I think, suggestions for their care and their treatment.
Absolutely. And to sort of see where the gaps are that are not necessarily medication or intervention gaps, but also lifestyle gaps that people may not have noticed, but are very contributory to why they have their migraines or the frequency of their migraines. And this is becoming more person centered care, which is what we aspire to do nowadays. We're in 2022. I think the healthcare professionals are moving more towards person centered care. It's really treating a patient how they wish to be treated, not how we would wish to be treated, but to really understand what their goals are. A migraine can be extremely intrusive, as both you and I have found out, into our family lives, our careers, and it becomes a how do we manage this in a way that is consistent with the values that we have. So, signing out from this introductory piece, anything else you want to add, Christie, before we record our second piece?
Well, I think, it's important to say we've spoken about this so many times, and I think our goal for doing this is really to provide, a place for migraine sufferers or people with headache. Maybe they haven't even been diagnosed officially with migraine to understand, the process from our lived experience, kind of as our through our lens as healthcare providers, our familiarity with various treatment options, and being able to discuss what it's like to be a migraine sufferer and live with that, but also, integrate that into the healthcare system. So I think will have a lot of, interesting things to discuss. And I hope that people tune in and can hear that and maybe relate to it.
Yes, I think we both have a shared enthusiasm for sharing what we know so it benefits other people. And we both love to teach, we love to share and educate, we love to learn ourselves as well, and we learn all the time. And so the series is called Migraine from Both Sides because it's a bit of a play on words. Usually, migraine is one sided in nature, but it can be either side when we suffer them. Also, it is the play on words to suggest that we are both sides of the desk, of the healthcare professional desk. Sometimes we are on the treating side, and sometimes we are on the receiving side. We are both healthcare providers and patients. So it's that kind of idea as well. So, ending our introduction, the next piece will be on the definition of migraines. Please join us. Bye for now.